Our most popular breast procedure at the moment is actually correction of inverted nipples. This can be done under local anaesthetic and can either be on both sides if it's a problem, or more often it's actually just on one side where the nipple is inverted. Of course, this is not a functional issue particularly. It is something that people generally don't like the appearance of, and is a very straightforward procedure to improve the outward appearance of the nipple and make it match one side or the other, or bring both out. Essentially what's happening is that the ligaments behind the nipple area, where the ducts or the milk ducts exit onto the skin of the nipple, become tight and retracted and pull inwards. This can be lifelong for some people, or it can follow breastfeeding. If you're concerned about nipple retraction or it's very new, then you should always have your breast checked by your GP if there has been some change that you're concerned about. If it is long-standing or you have had this checked out, then surgery to improve the inverted nipple involves dividing these ligamentous ducts so that they can no longer pull inwards, and also putting an interface behind the nipple, which some surgeons will use fat grafting in behind the nipple in order to help keep it bolstered out. I actually personally use hyaluronic acid filler as my interface because I find it increases the volume and the projection, and also prevents the nipple from sinking back in again. You'll be present at the clinic for approximately 2 hours, getting ready, having your surgery, and then getting ready to go home again. The procedure itself, depending on whether there's 1 or 2 sides, takes between half an hour to 45 minutes to complete. The dressing that's used is slightly inconvenient in that it has to protect the nipple in an out shape for at least a week while this heals. The sponge and a sticky dressing is used to bolster around the nipple to prevent pressure on the nipple while everything is healing, but this is removed at 1 week. And then patients can generally get back to normal with regards to showering and washing, and then also using an antiseptic cream to massage the nipple area as well. The results should theoretically be lifelong once again. Once these ducts have been divided, generally that solves the problem, although scar tissue can form behind the nipple and start to retract the nipple inwards once again. But if an interface has been placed between the ducts and the surrounding tissue of the breast, then that generally doesn't happen, but it can do. So retraction of the nipple, once again, is uncommon but can happen. And if that were to be the case, then the procedure could be repeated.